webinar. Welcome to your 5th session of the Integrated Eligibility webinar series for community partners. We have been bringing these to you in order to bring more learning and understanding about the new Integrated One system that we have all been using to help clients apply. And because this system now contains the programs for all of the medical programs, or the application for all the medical programs, you're now helping a wider diversity of clients apply for coverage. So that includes now folks 65 and over who in the past you might have sent over to an APD office, but now you can help them apply as well. And because that population is included in your application workflow now, the long-term care program has become of more interest to people. And it's something that we haven't known much about, so we've been learning about it. And today we're bringing you a deeper understanding of long-term care. So what I want to let you know is that we do post all of these webinars on group sites. I've provided the link here, and we post the recordings of the webinar as well as the slides from the webinar. And then we listen to the questions and we write them down into a Word document, and we transcribe the questions and the answers from today, so you can also peruse those visually. And then we translate all of those materials into Spanish as well. So all of those are posted in group site in the trainings and modules section, and I've put a link here. So please feel free to go back, listen to this again, and listen to the other ones for deeper learning. Now today you might have a lot of questions. I hope you do. Please type them into the questions box. You can find the questions box in the upper right-hand corner of your control panel. There's a little orange arrow, and if you open that up, there's a portion called questions. We can answer your questions publicly to everybody, or just privately to you. A lot of them, what we'll do at the end, we will save them up and we will answer them verbally so everybody can benefit from that question and answer session. And that's what we will transcribe later. So today's topic is long-term care services, also known as LTC. We're going to talk about who is eligible, approximately, how it pairs with medical benefits, and we're also going to talk about look-backs and estate recovery, things that we've heard about, and we're going to learn a little bit about how they function today and how they impact eligibility. Now, this webinar was brought to you by a whole team of people. I'm talking right now, but I am not the subject matter expert. We have external communications who've helped to bring this to you. We have our processing teams. We have policy teams for both MAGI and non-MAGI medical, and that's a deep well of subject matter expertise there for us. And then, of course, there's the OHA Community Partner Outreach Program, your ROC, and other integrated eligibility subject matter experts, so people that work on processes and solutions. And many of those folks are here today to answer your questions. They're in the background. You are not seeing them or hearing them right now, although you heard through our sound check, but they are really critical to us understanding this work and bringing this information to you. So a huge thank you to David and Christy and Janelle and Ada and Heather and Hillary and Joey, and I'm sure I missed people. So a big team behind you. So I'm not going to go through these screens of standard terminology, but we've decided to leave them in all of the presentations just as a reference point. We are assuming today that people have a basic understanding of the One system, a basic understanding of integrated eligibility, and a basic understanding that programs fall into two categories, MAGI and non-MAGI. And that the system has the worker portal and the applicant portal. But just to make sure we're all on the same page, I'm going to go through a very quick non-MAGI summary overview. In fact, this is actually a MAGI and non-MAGI summary overview. As you may remember from last webinar, if you attended, the One system, also called the upgraded One system, screens for 45 different medical programs, and each one of them has different eligibility criteria. It's a very complex system and a very complex algorithm. But to simplify it, those medical programs fall into two categories: MAGI, which stands for Modified Adjusted Gross Income, and non-MAGI, and that really speaks to how eligibility is determined financially. Now, MAGI is mostly for those under 65 or who caretaker relatives, meaning taking care of a minor in their house who is a relative. The non-MAGI program, that other bucket, is based on need. It's for those who are 65 or over, blind or disabled. And each of those programs have full OHP benefits. Under MAGI, it's just called OHP is generally what we call it. It's MAGI OHP. But under the non-MAGI, it's called OSIP-M, Oregon Supplemental Income Program Medical. Those are the same benefit packet, but for two different groups of people with two different sets of eligibility criteria. Now also, under non-MAGI, we have Medicare savings programs, and that is assistance to help pay for the costs of Medicare. That's not medical coverage, but it helps paying for Medicare. Now, I also want to make clear that we have column level benefits available under both the MAGI and the non-MAGI programs for people who don't meet all of the citizenship or immigration requirements for full benefits. Those column emergency only benefits are available under both programs. And this is where we get into long-term care. This is my segue. So long-term care is available under both MAGI and non-MAGI, but it's only available to those who end up with OHP plus level benefits. And we're going to get a little bit more into that because it gets a little more complex. But I think the important part is that it pairs with OHP plus. It does not pair with CALM or Medicare savings plans. So somebody has to have OHP plus level benefits in order to get long-term care. But I think you might find some surprising things in terms of how we expand that eligibility for folks even at higher income levels. And I think you might be very pleased at what the program does to make sure that more people are taken care of when they need it. So listen for that. There's your teaser. We left this in because it's a nice visual, right? We have these Medicaid packages. We have CALM, which is the emergency only coverage, and we have Medicare savings programs as two of the programs. But we also have the MAGI OHP, which is full benefits, and OSIP-M, which is full benefits. And either of those on the MAGI or non-MAGI side can be paired with long-term care. So that's just another way of saying what was in the previous slides. All right, David, do we have any questions or anything you want to weigh in on before we move on?
Nope.
Great. Here's what long-term care is. Long-term care is for people who might need help with activities of daily living, such as walking, bathing, or eating. Financial help can be available for that in general, like a family member could help and might be able to get some cost coverage for that. There's long-term care insurance, there's Oregon Project Independence, and Medicare might pay for some skilled nursing or home health under certain conditions. But another way to get those needs met is through the Oregon Medicaid paid for long-term care services program. So you're going to hear some terms interchangeably. There's long-term care, there's LTC, long-term care services, but also long-term services and support. And that all refers to the same program. So long-term care is a suite of Medicaid services, and it's available to those who need help with daily living activities or activities of daily living. That has a very specific definition, but it's for people who can no longer meet their own daily needs. Applicants must apply for long-term care. We'll show you where that happens in the one system. They will also need to have their needs assessed in order to see if their need level brings them up to that level to be eligible for long-term care services. Okay. So I said it before, but I'm going to say it again. Long-term care is only available to OHP plus members. You can have OHP plus without long-term care, of course, many people do, right? But you can't have long-term care without OHP plus, because it's actually OHP plus that pays for your long-term care coverage. So I want to make sure that that's clear. And I think it will become clear if it isn't. We already said this, but I'm saying it again. Long-term care can be paired with MAGI OHP or non-MAGI OSIP-M, either of those full benefits. Now, the interesting part, this is where the teaser comes in, and we'll talk more about it. is that when somebody needs long-term care services, because they have that level of need for daily activities of living, they are actually allowed to get OHP plus benefits at a higher income level. So even people who might not have gotten OHP plus normally, if they need long-term care, we bump up the income level at which they are eligible for both OHP plus and long-term care together. So you'll see what that looks like in a bit, but it's a much higher income limit, and that allows more people to get the services they need. Long-term care is available to children and adults, but it is not available to those only on COWAM or COWAM plus. So it's important to remember, it's only available for OHP plus members. The good news is that you apply for long-term care in the ONE system. Through that application, with the questions that you answer, one might be determined or assessed for the long-term care program. And where that happens is on one particular screen. So this screen right here, and this is right from our OHP training, our sister training, it asks two questions. Does the applicant need someone's help with things like walking, using the bathroom, bathing, or dressing? This does not include children who only need help because of their age. So you have to answer yes to this question, and you must answer yes to the next question. Does the applicant want to be contacted about in-home care services? The answer must be yes to both of these questions in order to trigger a referral for a long-term care services screening. I have had people come to me and said, why didn't this person get evaluated for long-term care? They really need it. And we looked back, and these questions were not both answered yes. So this is the point in the application that triggers that next level process. All right, David, do we have any questions or things to clarify before I move on?
Yeah, there are a few. First off, I'll kind of work backwards here. This question from Wendy. Do we know what those income guidelines are for LTC?
Hold tight, we'll get there. What's next?
Okay. And just to clarify, because I may have older materials from DHS, the Medicare savings programs are specifically QMB, SMB, and SMF, correct?
Correct.
Okay.
And those, yep. And those do not get paired with long-term care. If somebody only has those Medicare savings programs, they are not eligible to receive long-term care services. Anything else, or should we save the rest of the questions for later and see if they're answered in the presentation?
We got about 5 all at once here, and I'm trying to kind of decipher which ones to jump on here.
Right, the difference between just clarifications versus questions that we'll really get into at the end. And we will have plenty of time for questions at the end.
Let's hold these and move on.
Okay, great, terrific. So now we're going to get a little bit deeper into the weeds. We're going to talk about the different kinds of long-term care services, where you might get them, and some basic eligibility pieces that you might want to know about. So I'm going to pass it on to Janelle White. She's our non-MAGI policy contact for these programs. So Janelle, thanks for being here, and I'll let you take the next couple of slides.
Hi, thank you for having me. This is Janelle White. I'm with APD Medicaid Policy, and I will go through the next slides with a bit of a deeper overview than last time for long-term care and attempt to answer your questions. Let's go ahead and go to the next slide.
I think, Janelle, you probably have a delay.
I think so too, because it's not moving for me.
Okay,
That's not good.
So there's 3 types of long-term care services. That's what you should be seeing right now.
No.
I want to confirm that everybody else can see it as well. David, is everybody able to see my slide that says age and physically disabled services, intellectual, developmental, and behavioral?
I'm getting lots of no's.
No. The answer is no.
Fascinating. All right. What slide can people see?
The one that says long-term care is only available to OHP Plus members.
Oh, wow. Wait,
If you restart your slideshow.
all right. I can try to do that. Just a moment.
While you're doing that, I'll answer one of the questions that came up early on about the difference between OHP Plus and OSIP-M, and you know what the two different groups. So what we're saying is MAGI has its own financial and non-financial eligibility factors, you know, based on age and caretaker relative and all those things. And then OSIP-M has its own financial and non-financial eligibility factors. So there are two different groups of people that will be eligible based on whatever their situation is. But both, once eligible for either one of those, they get an OHP plus level benefit package. So it is the same coverage, which regardless of which group you're in. And each group, whichever one it is, does have the long-term care available. So hopefully that helps kind of clarify that we mean different groups just because it's based on different eligibility factors, but they get the same coverage.
Thank you, Janelle. I want to make sure that people can see the slide now that says 3 types of LTC.
I'm not.
That is not good. An issue with my computer, and I apologize. I didn't realize. It seemed to be working just fine. I will be contacting IT. So in the meantime, David, let's see if we have any other questions that we can answer that are about what we've already covered. Let's start there.
Yeah, I might take Janelle's guidance. If she wants to jump on some of those.
Absolutely.
Yeah, so I think the next one down, you answered the QMB, SMB, SMF. There was a question about the second question on the screen for the two questions that you need to answer yes to. Does the second question only come up if you do answer yes to the first question mentioned? And I believe, and maybe Autumn can correct me if I'm wrong, I believe both are queued regardless. I don't think it's
you have to answer yes to the first one, I believe, for the second one to
okay.
To be enabled. I believe
Awesome.
You can see him, but it's enabled once you click on the first one.
Gotcha. It's grayed out until you answer yes.
Mm-hmm.
Gotcha. Thank you. Please repeat those two questions that need to be answered yes in one to trigger review for long-term care. I don't remember those off the bat, but when we get the slide going again, we can maybe go back to that, or we'll go by it again and look at those two questions. Should we answer yes if the need is only temporary? So if the individual indicates that they have a need, do go ahead and answer yes, and eligibility will be determined in the background, whether it's something that is long-term care eligible. So I wouldn't say no and screen anyone out.
I just want to piggyback on Janelle that we have many individuals that actually receive long-term care services for a short period of time. For example, they can get hurt and need a level of care for a year or two or less than that. So our case managers will certify them for a short period of time. So that's possible. So yes, do not screen anyone out. Even if it's like they're saying it's a short-term need for service.
Thank you, Anna. The next question is, what are the differences in those Medicare savings through OHP? So we did go through Medicare savings programs relatively in depth in the last webinar, but basically the QMB covers, well, they all have different income guidelines. QMB is the best coverage or it's not really coverage, but it pays the most costs. It will cover the pay for the Medicare premiums as well as copays and deductibles. The other two, SMB and SMF, will only pay for the premiums. So that is the biggest difference between those. Next question is, are long-term care clients connected with a CCO? So yes, it's not really based on the long-term care. So to have long-term care, you have to have an OHP plus package. And by getting that package, you get connected with the CCO unless there's some form of exemption and you are able to keep an open card. So yes, they do get connected with the CCO on the medical side. Next one is long-term care screenings seem to be slower than urgent OHP processes. If someone has urgent medical needs, would it be appropriate to answer no to being contacted by LTC so they could go through the MAGI urgent processes, then update the application later to be screened for LTC? Boy, so if a person is going to be eligible for MAGI, now I don't know about MAGI's urgent process and maybe someone else can help with that, but I know that if a person is eligible for MAGI, they don't need the higher income limit or anything to get the long-term care. They're going to get that MAGI while awaiting the long-term care screening. So the long-term care shouldn't slow that down. Shouldn't slow getting that MAGI medical down. Now, maybe one of our MAGI analysts can talk about the urgent process, though.
You know, and I don't know that we have Joey here right at the moment. But I would, working with them, I know that they would probably not suggest, kind of approaching the process in a way to kind of try and make the system do something else to produce a different result. I think they would prefer, giving all the information as possible so they can make the best determination that they can with all the information they have. But we can take that piece back and Jeff or Joey.
I can speak to that too.
All right,
as well.
thank you, David.
Christy Taylor. I agree with what's been said. One will only delay determinations and require interviews for those programs that require those things. If it can do an immediate approval because it's going to be, for instance, a MAGI program that doesn't require an interview, it will allow the OHP Plus to be determined, and it will only delay the long-term care portion. So no, you should not try to manipulate the sequence in which you enter those.
And honestly, as far as I know, it's the same thing for non-MAGI. So a person can be eligible for non-MAGI and maybe even receiving it, that and MAGI for a while, and then have a long-term care need come up due to injury or stroke, whatever, and need to add the long-term care on top of that, and then they'd get a referral for that assessment. So the medical is not going to be held up if they meet the standard eligibility. When eligibility is held up is when a person is over that income limit to get the normal OHP plus, and they need the higher limit that only comes with long-term care, and that is coming up in a few more slides once we get those going again. But even if a person applies for non-MAGI, they'll get the medical approved while waiting for the long-term care to be added on top of it. A lot of the non-MAGI slowdown that we've heard from people is usually like the interview and the additional information that we have to do to get that standard non-MAGI eligibility approved. It's not necessarily just the long-term care. So does the person need someone's help with things like walking, using the bathroom, bathing, or dressing? And then do they want to be contacted about in-home care services? Those are the two questions. Okay, can we go ahead to slide 13 and I'll get started on the new information.
Okay, and I believe Deanna may have been disconnected, just a FYI.
Oh, okay, bummer. Okay. All right, so there are 3 types of long-term care. So there are care for the those who are aged and physically disabled. So it's anyone who's over 18, they may have a physical or even a cognitive disability. Now, I want to explain the difference between cognitive and maybe intellectual or developmental would be that those are more those who have strokes, those who are aged and have some kind of impairment that did not begin in childhood. It's mostly a later onset cognitive disability, whereas intellectual and developmental disabilities, it's for adults and children with an intellectual or developmental disability, as well as children with intensive medical or behavioral issues. So most of these, their disability had to initiate in childhood, and there are specific rules about what age. Then there's behavioral health services, and that's for adults who are 21 and older, and their primary need is based on a behavioral mental health diagnosis. So when we say primary need, there's often people who may have a physical disability as well as a mental health diagnosis, and we have a team who has to decide which one of those things drives their primary need for the services. And if it is a mental health diagnosis, then they would go into the behavioral health services. Next slide. So individuals can receive their care in a variety of settings. It can be in their own home by a in-home care agency or a state-approved provider that they would choose. Or it can be in some form of facility, either a nursing facility or a community-based care facility. And there's a variety of different types of those. But they can receive them in one of those types of facilities as well. Next slide. So we'll talk about the two parts of eligibility. In order to get the long-term care, they're going to get an interview, which is going to go over mostly the financial eligibility for that MAGI. Well, I guess MAGI doesn't have an interview, but the OSIP-M. They'll talk about all those financial and non-financial questions for the OHP Plus benefits, and that can be over the phone. The long-term care piece requires a needs assessment. So that's typically an in-person evaluation in their care setting. So in that facility or in their home, wherever it is that they are going to be receiving that care. And we determine what kind of care is needed and what the level is. That's typically in person, but right now, due to COVID, we are able to do that remotely by phone and just asking them the questions. Okay, thank you. So this is some of the service eligibility basics. It gets very complicated, so we're trying not to go too in depth, but the most important information for you guys to know for the three are the OSIP-M limits. It can be, income can be up to 300% of the SSI standard. So the SSI standard is the amount that SSI is each year. So like right now, people who are getting SSI, they get the full SSI at $794. So 3 times that amount. And then resource limits are $2,000 and $3,000 if they're a couple. And then MAGI limits, they don't change. So that information is the same for aged and physically disabled as well as the IDD. There is a special limit for those who have behavioral health needs. We're actually looking at 150% of the federal poverty level for their income, but all else is the same. Also, all 3 types of long-term care do have a 5-year look back for disqualifying transfers of assets. And then a little special aside for behavioral health is also that they must already be receiving those behavioral health services when they apply. Do I hear somebody trying to speak?
That was me, because I'm actually here, I'm back. And we're going to be talking about some of those things like the disqualifying transfer of assets that you might be interested in the 5-year look back period. So hang tight if that was new information to you.
All right. Next slide. Okay, so that 300% level. So when someone is over income for our standard OSIP-M, so they wouldn't be eligible for those that Medicaid Plus benefit package if it weren't for their long-term care service needs. So if they are subject to that higher 300% of SSI level, the OSIP-M won't actually start. They won't get that medical benefit until that long-term care eligibility is determined, because it's dependent on that long-term care need. So the long-term care will start on the date that they determine eligibility, but then we'll actually backdate their OSIP-M medical start date to the first day of that month. So let's say today someone was approved for long-term care, they would get their OSIP-M back to the first of this month. Also, a unique thing with long-term care is that sometimes recipients will have to pay part of the cost that the state pays. So, and that totally depends on where they're living and their income and deductions. Anyone with higher income is more likely to have a payment or a higher payment. Okay, next slide. So when someone is over income for OSIP-M, but they'll be evaluated for long-term care, they're going to get this screen. I believe this is an AP screen, applicant portal screenshot. And this is what it'll look like when you look in and see what their eligibility results is for. You can see that they're pending for completion of the application process. This screen I'm not actually that familiar with, so if anybody wants to go more in depth on it, that would be great. But this is what it would look like if someone is pending for the long-term care. Okay, next screen. So just like we kind of touched on before, regardless of the length of the need or how much the need seems to be, we want to always encourage people to apply. We don't want to screen people out. There's lots of ways to get long-term care, even if they have really high income, even if it's over the 300%, it is still possible that those individuals, based on whatever their deductions are or anything else, they could get long-term care. And so even if they have that really high income that's over that 300% level, still have them apply, and then they can work with APD on what's called an income cap trust. We don't want to go too far into that. That gets pretty detailed, but just know that those with over 300% of the SSI income could potentially be eligible if they get an income cap trust, and APD, AAA offices can help walk a person through that. We will actually pend for that as well, and that's what the notice looks like on the right-hand side. Signed income cap trust. What's that?
Oh, Janelle, I just wanted to make sure that that I think that the message for me is that many people, even with higher income, can be eligible for long-term care. Looks different for different income levels, but there's sort of a tiered process to make sure that people can get those services if they need them. And people should always apply, regardless of their income, because there are many creative ways that the state sets up to make sure people are taken care of when they have those service needs.
Yep. Okay, next slide. And just let me know, Deanna, when you want to, when we want to stop for questions. I see a lot of them popping up.
Okay. I'm tempted to say we have 2 more slides of content, which is the look back period and the time penalty and how they're related, and also the the estate recovery. So I'm tempted to say, I can go either way, but we have 2 more slides of content.
How about
and this webinar goes until 10:15, and so we right now have 25 more minutes until we finish.
Okay, let's go ahead and get the last 2 slides done, and then we can go through all the questions. Just leave Q&A for the end.
Sounds good.
Okay, so look back period. Some of you have heard of it, some may not have. So the look back period is where an individual applying for long-term care, we look at their resources over the past 5 years, and we do that by running AVS. But what we're looking for in
That's
that
asset
time,
verification system.
sorry, yes, me and my acronyms.
So we've been the acronyms.
So we look back 5 years from the date that they requested those services to see if they have transferred any of their assets for less than fair market value during that period. If they have, and it's determined that it was a disqualifying transfer, they may lose eligibility for long-term care services for a period of time. There are lots of rules that go into what is disqualifying and what's not, but if they are disqualified for a transfer of assets during that 5-year time, they may be able to keep their medical, but they would be ineligible for their long-term care until they serve a time penalty. And that time penalty is based on the dollar amount of their transfer. After that period ends, they can reapply for the long-term care. Okay, next slide. Then there's this thing called estate recovery. There is a brochure that is given out to long-term care applicants about it that helps explain more, but basically estate recovery is when a long-term care recipient passes away, the state may require that person's estate to repay the amount that the state paid for those benefits. It only applies for long-term care, and they cannot seek reimbursement for more than they've paid. So they're only going to take back what they've actually paid for those long-term care services. It's really, really complicated. We don't even allow our workers to try and explain it more in depth, and we just have everyone direct their questions to the actual estate administration unit, or they could do, I believe it's an elder law attorney. So there's the link to the brochure if you guys want to look a little more about what your clients are going to receive.
So Janelle,
Okay.
I'll actually cover the next slide. It's
Okay.
there is, I lied, there aren't 2 slides, there are 3, because we have one more slide about estate recovery. And I think it's, oh, and there's no screenshot. It's not showing up. But that's okay, because I put the text in, that's so bizarre, I put the text in the side as well. But what I wanted to show you here, bummer, is that on the last pages of the applicant portal, when somebody is applying, there's all this disclaimer language that people then sign and submit to. And in that language, it talks about estate recovery, and it often trips people up. It sounds concerning. They don't know what it is. They think, well, if I'm going to get Medicaid benefits, I don't want if I pass away, I don't want my spouse to have to then pay back my Medicaid benefits. I don't want my children to have to pay for that. So what we wanted to call out is the fact that estate recovery only applies to those who are in long-term care services. It doesn't apply to any of the other programs. So it's only if somebody applies for, is evaluated for, and ends up with long-term care services. And if that person passes away and estate recovery comes into play, the estate recovery unit will not make a claim if there's a surviving spouse. So people's concern about taking care of their family is accommodated by saying, if you have a surviving spouse, we are not going to come and try to claim assets from your estate. And likewise, if the client is survived by a minor child, actually it's not just a minor, it's under 21 years of age, or a child of any age who is visually impaired or permanently and totally disabled, the estate recovery unit will also not make a claim under those conditions. So when people are worried about estate recovery, we wanted to call out that it is under very limited conditions. It's only if somebody has long-term care and they pass away and there is no spouse and there are no children. So, and I have when we send out the slides, which we will, you will see the screenshot of that, one of those final pages of the applicant portal, and I've highlighted the boxes where it clarifies that. So what you as community partners can do is you can point that out to your clients if they have questions. You can give them the estate recovery phone number and email address. You can give them the estate recovery brochure, but you can also point out that estate recovery only happens under very limited conditions. So that's what we wanted to address because it's been a big question from community partners. Right, next slide. Oh, look, there's animation, and I didn't set that up. I don't know why, but there it is. So that you might recognize this screen. It's at the end of the applicant portal application, and it says DHS and OHA will defer, meaning not follow through on, will put off a claim for money if your spouse survives you. And DHS and OHA do not claim this money from your estate if any of the below members of your family are still alive. So those are two very important pieces of estate recovery, in addition to the fact that they are only in relation to long-term care services. So I hope that helps calm some of the questions and concerns that I've heard from community partners. Right. I think that, yes, that was the last content slide. So now I have a feeling we have lots and lots of questions to further our understanding of this. So let's dive into those. David or Janelle, do you want to help us out with that?
This is David. I would probably defer to Janelle how best, if I can be useful here, or if she just wants to kind of move down the questions.
If it works for you, I can go ahead and move down the questions like before.
Yep, go ahead.
Okay, cool. So I think the one that I need to follow up on was the one from Melinda, wondering if that was one of the questions that triggers the long-term care questions, and that was regarding, hold on, let me scroll back up here. Does the person need help with bathing? Oh, yes, so that is, so if the person needs help with bathing, dressing, etc., that is one of the queuing questions for long-term care. And then they have to answer yes to the second question. Okay, so next is just for clarification, for 65 plus, they must already have Medicare for them to qualify for OHP, or can they be 65 plus, not have Medicare and still receive OHP? So we have a requirement for our programs that individuals pursue any asset they may be eligible for. That includes not only financial assets, but also medical coverage. So if they're employed and have medical coverage, cost-effective medical coverage available through an employer, they have to pursue that. It's the same for Medicare. We require that they apply for Medicare if they are eligible before they are going to be eligible for our OHP plus Medicaid programs. So that is because the state is the payer of last resort, which is what we say. So basically they want to bill all other available medical coverage before the state gets billed. Let's see, all this is rather limiting for a patient that is homeless currently. Yes, so for long-term care, unfortunately, you have to be in some form of living situation where you can receive that care, and homeless, unless they're able to go into a facility or someone's home, they're not able to receive the care. Let's see. Yesterday, a person called because her disabled child was denied for OSIP-M. She was under the impression that all disabled children should qualify for Medicaid. Urged her to contact APD for a better understanding of why she may have been denied. Do you have an idea of when the offices will open to the public again for in-person assistance? Oh,
a lot in there.
Yeah. Okay, so I believe our offices, I'm not up on the current office restrictions, but I believe they're able to take people in.
I thought so too, and that might also be a Hillary Thompson question for more clarity. But if you need to make an appointment, or can you just walk in? Maybe David can ping Hillary.
So as for denial, so all disabled children are not automatically eligible for Medicaid. There are several factors, and it does include looking at the parents' resources, and that gets really complicated, so I won't go into that. But the reasons on the denial should give some indication of what happened there and why the person was, the child was denied. And then if a person needs further explanation of the reason that's on the denial notice, they could contact APD to explain a little further. So the next one is, will the slides be sent out? Yes, it was sent out. So you can click the links and see all the visuals. Where can I find out what the income limit is for non-MAGI medical? Basically how much monthly income someone with a disability can have or make and still qualify for non-MAGI medical before the 300% rule needs to kick in. So I don't know if maybe Deanna wants to send out a link. That gets really complicated. We have a form called the 5530 that lists all the limits, but the caveat to that is many of those are adjusted income limits for the standard OSIP-M, which means we've adjusted them by excluding certain or taking out certain deductions on their income. So you don't want to take a person who maybe makes $800 a month and say, oh, you're over the $794 limit. I mean, those may give you an idea, but still have them apply, because there's a lot of things that we do behind the scenes that person could be eligible. And then there's a lot of different programs that goes with non-MAGI that have different eligibility factors.
And I'm going to say what we always say, which is we are not eligibility workers. We should never, ever tell somebody they even might not be eligible. Because it is so complex, especially with the 45 different programs. So people should always apply. Janelle, you said that the basic amount was $794, but then that there are all sorts of adjustments to that, right?
Yep.
And types of income that aren't included, right?
Exactly.
So, but I think there's an important distinction there, which is that some of these programs are based on a percentage of FPL, federal poverty level, and some of these programs are based on a percentage of SSI, or supplemental security income. So it's just important, good to know as you see things. It might explain some differences. But when it comes to the eligibility limits, I really want to double down on what Janelle said. Don't worry about them too much, because we can't know the algorithms.
Thanks, Deanna. Next question is, does estate recovery only apply if the person's estate has money available? They have a house in their own name, no spouse, and no children. So, I mean, estate recovery applies, but if there's nothing to recover on, obviously they won't be able to make a claim. So, if they have no spouse, no children, but the house is in their own name, estate recovery will likely try and recover on that. But again, we don't want to go too far into that kind of stuff. There's always caveats and special rules.
Yeah, but the basic premise is that if somebody has resources, and those resources they're not going to go to a spouse or children, and they have utilized the state to support them through long-term care services, that there's some recovery there for the cost of that, care. That house then doesn't just go to the person's best friend, right? It goes to providing support at the end of life.
And the next one is about estate recovery as well. If they agree to estate recovery and Oregon adds Medicaid services to this requirement, then they will be obligated under estate recovery. Okay, so by accepting the services, they are agreeing to state recovery. It's a requirement of receiving those services. So they wouldn't, I guess I'm confused about Oregon adding the Medicaid services to the requirement, but basically if they get services,
what they
state
mean,
recovery applies.
I think, yeah, I think they're talking about somebody who's over the 100% of SSI, and they're only getting Medicaid because they're on long-term care services. That's how I'm interpreting it. And the question is, if a state recovery comes into play because they don't have a surviving spouse or surviving children, then is it just the cost of their long-term care that needs to be paid back by their estate, or also the Medicaid services that were part of that whole package? And I think the answer is that long-term care is part of that Medicaid package at that point, and they're all together. It gets paid for. The long-term care services get paid for by the Medicaid coverage.
Correct. Okay, so when the surviving spouse dies, then EAU will file a claim against the estate, correct? Yes, I do believe that's correct. As long as there's no disabled child in the household as well. And again, we're getting real deep into when EAU will file a claim and that, and we don't want to delve too far into that.
Yeah, if people ask about estate recovery, instead of trying to answer questions, like I would say you can say basically what it is, and I would encourage, you can share what we've shared today on the slides, and other than that, we really should refer them to the estate recovery unit, because this is a deep well of detail that we are not experts on.
Right. Okay. So the next one is I work with someone who has had employer insurance through a job he left in the early 90s because he is on long-term disability. Would he be able to apply for OHP Plus and terminate the employer insurance since he is no longer technically employed? I can't fully answer that question. So if that coverage is cost effective for him, so if he's not paying, you know, like Cobra's $1,200 a month, which is not cost effective for anyone, then he would need to keep it. He could apply for OHP and have it as a secondary coverage, but he would need to keep the other employer-sponsored insurance. If it is determined that that employer-sponsored insurance is not cost-effective and it is a crazy expense for him, then he would probably be allowed to drop that insurance. But you wouldn't want to, that wouldn't be figured out until after he applied. We have a group, the health insurance group, that determines what is cost-effective and what is not, and would let the person know what they could do with that insurance. So in that situation, like most, you can go ahead and apply. They'll tell him what he can and can't do with that insurance, whether he needs to keep it or not. And if he's required to keep it, he can then make a decision on whether he wants to keep the OHP or not.
So I think that what I'm hearing, Janelle, I want to make sure that I heard what I think I'm hearing and put it into community partner language, which is that there's this requirement to pursue other health coverage, right, if it's affordable. And that's a standard Medicaid requirement. And what I'm hearing is that even when somebody is above that 100% of SSI and they're on long-term care and therefore receiving Medicaid, that requirement to pursue other benefits still is in effect. That's what I think I heard.
Mm-hmm.
Right?
All right. Yes,
okay.
Thank you. Let's see, if a CP starts an application, how does the portal determine which APD office to send it to for an interview? Okay, so I believe most of them are going to the VEC, the Virtual Eligibility Center, but if it is long-term care and they need an assessment, it's based on the zip code. And so one will refer it through to our central office, who will determine which office it needs to go to for that piece of it. And that's for the assessment. And anyone else that's on the call can correct me if I'm wrong, but most new applications that need an interview are going to the VEC for the most part. Let's see. Someone said no walk-ins at Northeast APD. Okay. Offices are open in Douglas County. Okay, so I guess it depends on where. Probably depends on staffing as well. Okay, so where am I at? Oh, somehow I went up. Sorry. Hold on a second. Once long-term care was attached, it seemed like interview process responsibility moved to the local office rather than the non-Magi interview team on a case with a long-term care request. Am I correct in understanding we, the client, should up with the local
Follow
office
up
as a
and up.
follow up? And there we go. Thank you. As opposed to the normal non-Magi interview line. This is a process thing I'm not sure that I can fully answer.
Right, that might be a Hillary question. I think the question is when somebody needs an interview for long-term care, is it the regular interview process? And in fact, we still have from last time the non-Magi interview FAQ, which it's loaded up into the webinar files. And that guides you through helping a client connect to their interview for non-Magi benefits. And the question is that still the right guidance for long-term care, or does that become a different way to connect them?
As far as I know, they're supposed to go through the interview and then be referred to the local office for the assessment and the asset verification system. I haven't heard that they're just bypassing that virtual eligibility center and having the interview and everything done at an office. So if that's happening, it's not something I'm aware of.
We can follow up with it also,
Janelle,
Sean,
yes.
to see. Yeah.
Ada, go ahead.
Yes, you are correct. So we do have a combination. I mean, if the individual is applying directly, you know, in one of our storefront offices, then that will most likely be done there. But any eligibility worker can complete that interview, and I've seen it completed by VEC workers or, you know, other type of workers that are not specifically non-Magi APD workers. And like Janelle said, you know, there's a point where they will need an APD worker, a non-Magi worker, to complete that asset verification request that right now is no part of the integrated system. And the long-term care interview, it's pretty much they go through the process of, you know, kind of like a non-Magi medical interview because they need to know about resources and transfer of assets. You know, for the clause that we have for the 5-year look back.
Thank you, Ada.
Thank you.
What are the options for unhoused clients who need long-term care but don't have the resources to enter a long-term care facility without having those benefits in place? So we have done assessments on those who don't have a house. It gets a little complicated, but we will accommodate them. Sometimes we've had them come into the office to do an assessment. That way we can see what their mobility needs are. And if they become eligible, then we can help place them into a facility. So it is possible to get a person who is houseless onto long-term care. They just have to agree to go into a facility or find a place to receive the care.
I think there's also a question, Janelle, perhaps about the behavioral health services. It says that in order to be eligible for long-term care behavioral health, you need to already be receiving services in a facility or at home, right? So for somebody who's houseless, it would be in a facility. But if they don't have the resources to get into a facility, how do they get into that system? I think that might be part of where that question's coming from.
Gotcha. More on the behavioral health side. I understand that. I am not a behavioral health expert, and you know, it sounds like the proverbial chicken and the egg thing. I don't think I have an answer for that.
Mm-hmm. Okay. So I think we have time for one more question, and then what I promise to do is make a transcript of all the questions, even the ones we didn't have time for, because there are still a few more, and get answers and get that out to you. Of course, it will not be overnight, but it will happen as it has in the past. So let's take one more question, Janelle. Choose
Okay.
carefully.
Right? There's like 8 left.
I like this one. There's a good one.
Go ahead.
Can you get long-term care if OHP is your secondary insurance?
That's the one I was looking at. Yes, absolutely, you can. You can get long-term care if OHP is your secondary, because eligibility is if you get that OHP, you can get long-term care. Now, how that looks on the back end with billing, I am not sure, but I do know that the eligibility side, yes, you can.
Great.
I don't know if
All
your
right.
primary would pay for any of it, but
Well, that's good to know they can coordinate. So thank you very much. I think if we go to the last slide, Dina, it will remind us all about where we can find these, all the resources for this. The next IE webinar topic is still to be determined, but if you are here today, you are automatically registered for the next one. It should be showing up on your calendar, and you should get reminders about it in your email. So what did I want to say? Thank you for bearing with us with the technical difficulties. We will, the slides, I posted them to this webinar. So if you want to grab them right away, I posted a PDF of the slides. It was a smaller file size, so it worked better. And you have them right away. I will also go and post them to group site under the link that we shared. And we hope that this was helpful. We actually would I'd like to take a moment for anybody who's still here to put into the questions box what you are interested in for the next topic. So we, as a team, will be getting together to talk about what we heard today and what we think might be the next topic to bring to you. So thank you to all of our subject matter experts. Thank you to Dina for stepping in and taking control of the computer situation, and for everybody who helped bring this information today and resolve our technical difficulties. So I hope it was useful. Stay tuned for more materials, and have a wonderful Wednesday. And with that, we can conclude the webinar. Thanks, guys.